Hello everyone, this is Raymond. Today I want to talk about why dentists need CO2 lasers. CO2 lasers are used to provide patient comfort by cutting and sealing tissue at the same time. Let me compare conventional treatment with the CO2 laser treatment. This picture shows the necrotic layer. This is a layer of dead tissue that causes pain and swelling. CO2 laser cuts deeper but has a thin necrotic layer, making it minimally invasive. Now, let me compare the CO2 laser with other lasers such as diode, ELEC, and NDF. This picture shows the penetration depth. CO2 and EL lasers are water absorption type lasers, which penetrate very shallowly at 0.02 to 0.5 millimeters. Diode and NDF lasers penetrate deeper at 2 mm. Diode lasers have a low concentration on soft tissue, which causes extensive thermal damage zone of several millimeters. CO2 lasers are more efficient than diode lasers for soft tissue ablation, incision, and excision. Diode lasers are good at coagulating but poor at cutting. CO2 lasers are good at both cutting and coagulating soft tissues. Diode lasers are cheap to buy but expensive to use. The disposable diode laser tip costs a lot every year. ELEC lasers are the king of lasers. They can treat both hard and soft tissue, making them versatile. EL lasers can remove contaminated soft tissue and bone. EL lasers can also remove contaminated HA coating on the implant fixture at the second stage. EL lasers are good for this symptom. CO2 lasers are not good for peri-implantitis second stage, but they are good for peri-implant mucositis. EL lasers are slow in incision and excision, and they are inefficient in coagulation. They cannot be used on soft tissue treatment like CO2 lasers. CO2 lasers are 5 to 15 times more efficient than EL lasers. NDF lasers are good for sulcus laser debridement or perio treatment. The main cause of perio disease is in the sulcus contaminated pocket. The quartz fiber 200 micron goes into the sulcus and delivers the laser beam. NDF can remove the epithelium inside of the sulcus to expect reattachment of the tissue to the bone and rising of the bone ridge. However, NDF lasers are not as good as EL lasers in terms of speed and efficiency in incision, excision, and coagulation. As you see from this chart, CO2 lasers have a broad range of applications. Thank you for your time. I hope this is helpful. Let me know if you have any other questions.